From News and Information 570 AM, this is the Stinchfield Report.
Hi there, I'm Brad Stinchfield. Happy to be with you, taking you through all the way till 7 o'clock. So you know that Obamacare is a bad law. It is a destructive law, and specifically destroying our healthcare system as we know it. Look, I've been out there. I've talked to doctors personally. They are either changing the way they do business or getting out of the business altogether. I know very successful doctors who are going back and getting their MBAs because they're going to get out of the business of being a doctor. Because when the government offers you 50% of what you should be charging, you're not going to make any money when it costs you more to do business than you make. Well, some doctors are changing the way they do business. One of those is Dr. James Pinkney. Dr. James is the founder and CEO of Diamond Physicians. Doc, thanks for coming on the program today.
Thanks for having me on the show.
So you are not a fan of Obamacare, I take it?
Well, the Affordable Care Act, it's a challenging law, and it's really difficult when you run a traditional insurance model to keep the doors open at this point. A lot of physicians, just like you said, are getting out of medicine altogether.
Are you going to stay in the business?
I'm staying in the business. I'm staying in medicine, but I've completely changed the way I practice medicine. I've developed a completely different healthcare delivery model that not only saves clients money, but also delivers a better product.
All right, so tell me what you're doing, because I know you're not accepting traditional insurance, right? Have you gone to all cash?
We're a hybrid model right now, but eventually we will be all cash. So right now we're a membership-based model. It's a form of concierge medicine that we're calling direct medicine or affordable concierge. So our clients pay a monthly membership fee. Kids start at $45 a month, adults start at $95 a month, and you receive unlimited visits, zero copay, and 24-hour access to your physician, as well as 24-hour access to our urgent care facility. We have transparent prices. You know exactly what you're paying for and what you're going to receive in return for your hard-earned money.
So I would imagine this has got to be a numbers game for you. The only way this works is if you get large amounts of people to sign up.
The numbers aren't that large. The average family medicine physician is going to see between 3,000 and 5,000 patients to keep their doors open. We take 500 patients per physician, so it's a very limited number, and that way you receive personalized individual care instead of just being a number.
Okay, and now this, I believe, is a response to what has happened with the healthcare industry. Most impactful was Obamacare. This is a free market solution to a government-caused problems. Are you waiting for the curtain to fall and the government say, "Hey, you're curling in on our business. We're shutting you down"?
I don't think that's going to happen. I think at some point they're going to have to realize that the Affordable Care Act, it's got so many difficult portions of the law that don't make sense. It contradicts itself. The plans that are out there right now are not good. The HMO plans, if you go on the exchange and purchase an HMO plan, I'm telling you right now that most physicians are not going to accept that insurance, and they don't tell you that. So you can go through the list online and see what doctors are supposed to accept it. You call that office, and you cannot schedule a visit, and that's what we're finding that's happening.
So for your fee for the month, if I need to see a dermatologist, do I get a dermatologist? Do I get to go to an orthopedist?
Absolutely. We've got a Diamond network where we have spoken with physicians in our area. We're in the Park Cities, so Northwest Highway and the Tollway, and we have a network of physicians that will see our clients within 24 to 48 hours. So the average wait time to see a family doc right now is 45 days. To see a specialist, you can wait up to 3 months. And our clients get in within 24 to 48 hours because we've negotiated our specialist, our dermatologist, orthopedics. I had a patient about 3 weeks ago that fell off his horse, hurt his shoulder. We've got mobile imaging. I sent a mobile imaging company out to his house, snapped a couple of x-rays. I saw them on my phone. He had a shoulder fracture, brought him in, put him in a splint. I got him an MRI. MRI is typically going to cost anywhere from $4,000 to $5,000 with our traditional insurance model, and you're responsible for your deductible. So if your deductible is $2,000, you're going to pay $2,000 out of your pocket. Well, I got an MRI for $350 cash pay. I negotiated those rates in advance. So we pass on those savings directly to our clients.
All right. So, and they're paying a flat fee a month typically for a individual is what?
Exactly. It's based on age. If you're in your 20s, it's $95. If you're in your 30s, it's $135. 40s and 50s, it's $195. We're running a special for the summer. And if you're over 60, it's $295. So again, a couple $100 a month is going to allow the consumer to truly guarantee themselves a concierge doctor.
And the goal is, and it's got to be somewhat similar to insurance, because you're hoping that not everybody uses it.
It is kind of like a gym membership, so not everyone is going to use it, but it all balances out. So some people are going to use more resources than others, but the point is you always have a doctor on call for you 24 hours a day.
But if
So
everybody uses it, Dr. Pinckney, if everybody uses it, it can't work.
You mean the entire nation?
Yeah. Well, everybody that you sign up, if everybody were to use it 1 month, there's no way you could fund it. Am I right?
Oh, no, absolutely. That's why we hold off on the number of clients that we take. So 500 clients is the maximum. Now, over that, you're absolutely right. You start diminishing the level of care that you can give.
Okay.
But at 500, every client is going to receive exemplary care and 24-hour service.
And now what happens for an emergency? You get in a car wreck, you go to the emergency room. Are you covered for this?
That's when we typically tell our clients to have at least a catastrophic plan on board. So insurance is for emergencies like a car accident, not for urgencies. But because our system is so backlogged, everyone uses insurance for urgencies, but they can't get in to see their physician. So we do recommend having at least a high deductible plan to cover yourself for surgery, for hospitalization of any kind, for emergencies.
Yeah.
And then our job is to keep you out of the hospital.
Correct me if I'm wrong. One of the problems with Obamacare is that every insurance policy is mandated to cover certain things. So the old-fashioned super high deductible catastrophic insurance policy really doesn't exist anymore. You may have a super high deductible, but guess what? It allows me to still have a baby, and I'm a guy, which I can't even do.
Yeah, that is true. That is very unfortunate right now with the Affordable Care Act. A lot of the policies have been consolidated, so you can't strip out things that you don't need. Males do not need maternity care. And you're going to have to pay for it now under these new exchanges.
Well, I love the idea, Dr. Pinckney. I really do. And I think this is the ultimate of what can happen when you let free markets try to solve problems. And typically, problems in nations, especially the United States, are caused by our government at work.
Well, thank you so much, and we agree. Direct medicine, Diamond Physicians, is the solution to our healthcare crisis, and it truly is a crisis. We're spending too much money, almost 16% of our GDP, on healthcare. That doesn't make any sense. No,
it doesn't. Why don't you, real quick, give me the website.
It's diamondphysicians.com, and you can contact us at 214-395-3491, diamondphysicians.com.
All right, Dr. James Pinckney, we appreciate you coming on and talking about this. Good luck with it, okay?
Oh, thank you so much. Have a great day.